Hi, I'm Tara, and I'm going to talk about lateral violence today in nursing. So, when I think of lateral violence, I think of bullying, I think of hostility to those who are lateral or on the same level as you. Lateral violence can also be described as a verbal or nonverbal aggressive behavior directed towards nurses. And then there was an article written by Ellie Falletta, who is an MSN at Johns Hopkins University, and she writes in her article that lateral violence can be described as nurses covertly or overtly directing their dissatisfaction inward towards each other, towards themselves, and towards those less powerful than themselves. So let's talk about some examples of lateral violence. The most common is verbal abuse. There can also be violent threats, physical violence and intimidation, sexual abuse, backstabbing, invasion of privacy, and just being ignored. I was curious as to what the cause of lateral violence is. So there's 3 theories that I found about why lateral violence takes place. The first one is the oppressed theory. So this basically says that nurses are powerless in healthcare and they have limited power in their practice, which leads them to use lateral violence as a way to make themselves feel like they have more power. Secondly, there is a theory that there's a hierarchy or patriarchy in healthcare. So basically, there are still male physicians and administrators who are above nurses, and nursing is still predominantly a female profession. So that male oppression leads nurses to feel powerlessness and have fear, which then again they take it out on each other. And then thirdly, that lateral violence is just part of nursing culture and that it's a rite of passage. So these nurses have the mentality that, oh, it happened to me, so now I'm going to do it to you. And I guess along with that, they feel that it'll make the new nurse stronger by building resistance to stressors in the workplace. Unfortunately, lateral violence is still very prevalent in nursing. I'm sure we've all experienced it in some way or another, whether we're the perpetrator, we're receiving it, or we just witness it with other coworkers. But actually, not surprisingly, new graduates are the most common victims of lateral violence, I guess because they're easy targets or because it's part of the nursing culture. And also, lateral violence is most prevalent in the ICU setting. One study showed that 82.8% of nurses in an ICU reported lateral violence in the past year. And as I mentioned earlier, verbal abuse is the most common form of lateral violence, with 63.8% of nurses being exposed to verbal abuse. And finally, unfortunately, lateral violence has been increasing over the past decade instead of decreasing. So it is not dying off with the older generations, unfortunately. I also want to discuss the effects that lateral violence can have on the victim. So first of all, it can cause absenteeism. So the nurse wouldn't be showing up for work. So basically they're trying to avoid the abuse. Secondly, it can cause decreased work satisfaction. So whether it be that the nurse, because of the things that people are saying about them, they believe them to be true and they feel like they're not doing a good job. It can also cause increased stress, which unfortunately can lead to bad patient outcomes. Also, another contributing factor to poor patient outcomes with lateral violence is that there would be a lack of teamwork between the nurses. Lateral violence can also cause burnout, depression, and PTSD. And then I just wanted to discuss some real-life examples of lateral violence. And all of these I have actually witnessed or been on the receiving end of in my career. So first I have a more senior nurse purposely giving a new nurse or just a nurse that they don't like a heavier or undesirable assignment while they take a better one for themselves. Secondly, nurses talk badly about each other behind the other one's back instead of just addressing the issue face to face. Thirdly, eye rolling, which may seem insignificant, but it still can hurt people's feelings. And finally, I've seen a new nurse ask a more experienced nurse a question or for advice, and the more senior nurse actually belittles the new nurse instead of being helpful and providing them with, with the advice that they need. So, unfortunately, lateral violence is a big issue in nursing, and I believe that it is not something that we need to add to all the other existing stress that we have just as part of that comes along with our job. Just taking care of patients is stressful. So I believe we need to work as a team, and we need to work on our confrontation with each other in order to promote a better environment for each other.